Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to continue our discussion of pain management after knee replacement surgery. And we're going to look at specifically in this video some non-pharmacological strategies of pain psychology or using pain science to help manage your pain after knee replacement. So here are 5 ways that you can use pain psychology, we'll call it, to help manage pain after surgery and hopefully reduce your need for opioids, reduce your need for pharmacological pain medicine. So one is mindfulness. So mindfulness is kind of just a general state, a state of mind. So being aware of your surroundings, being aware of the present moment, being aware of your breathing. When it comes to knee replacement surgery, there's probably 1,000 different things running through your head. There's, of course, the pain itself. There's fears. Will I ever get better? How long is this going to take? There's anxieties. There's fears of movement and doing too much or doing too little, of having to go to therapy later, of not being able to sleep, of maybe you don't have an appetite because you're still coming off of analgesias or pain medicine. So there's a lot of different things running through your mind with after knee replacement surgery. And one of the things is just focusing on that state of mind of being mindful of your surroundings and what's going on in the present moment. And one thing that goes in line with this is focusing on what's within your control right now. This pain isn't going to go away in 1 minute. I'm not going to heal and recover in 1 minute. I don't know what the future holds, but I do know what I can do right now. And maybe that's just trying to relax and maybe trying to elevate your knee and put some ice on it. Or maybe it's doing a couple exercises. Or maybe it's going for a short walk, whatever that may be. And so with number 2, I think transitions well is having a mindset of acknowledgement or acceptance. So accepting that the knee replacement process is stressful, accepting that there's going to be pain, there's going to be discomfort, there's going to be obstacles along the way. The more that we try to fight that and try to oppose it, the more it's just going to feed into increased pain, increased discomfort, increased tension, increased swelling. All these things are just going to compound and have that domino effect. But the more that we can say, okay, this is just the nature of the beast. I'm going to accept this. I'm going to acknowledge it. I know that it's normal. It's a normal part of the recovery. Almost everyone who goes through a knee replacement goes through all these things that I'm going through, and it will get better. It will get better over time. I gotta do my best to be patient, to be focusing on this current moment and what's within my control. So number 2 is going to be acknowledgement or acceptance. Now here are a couple more actionable things. So meditation. Some of us may have experience with meditation, some of us have none at all. The good thing is the internet and YouTube and different apps on your phone, all sorts of different options out there for someone who wants to meditate or practice some sort of meditation or mindful thinking and just relaxation. And I encourage you to do that. If you're experiencing a time or a day where you just have loads of stress, loads of pain and discomfort, just go on YouTube and look up 5-minute or 10-minute guided meditation and just go through it and relax and come into the present moment. And I think meditation is a really great option to take your mind off of the pain, take your mind off the other symptoms and the stresses and the anxieties, and just focus on the present moment and do a meditation that's gonna, in essence, just if nothing else, distract you from the pain and have you focusing on something different. The next thing is just relaxation or breathing techniques. So not necessarily a formal guided meditation or meditation on your own, but just doing some breathing. So, taking a minute and doing, 5 big deep breaths through your belly using that diaphragm, and just focusing on your breathing as well is very important. I won't get into the nitty gritty of, how should you breathe, and should you breathe out your mouth or your nose, and breathing in and out and the count. But, if you want to dig into that a little bit more, you can look up, some videos on YouTube, look up different websites, different apps. There's a lot of resources out there for that. But in the simplest form, just doing some nice deep breathing to relax yourself, calm yourself, decrease that autonomic nervous system, that sympathetic nervous system, calm everything down. And that's going to play a big role in helping with managing your pain and symptoms as well. And then the last one I would say is just doing different mindful activities or mindful movements or actions. So this can take on, again, a lot of different forms. Maybe it's going for a walk and just being extremely mindful when you're going for that walk. What's going on in your surroundings? What's going on in your environment? What are you feeling within your body? Maybe at your knee, but also other parts of your body. What are you feeling? Think of your 5 senses as you're walking. It may be cooking a meal or preparing a meal. It may be sewing or crocheting. It may be, working on some other project. It may be reading a book. All sorts of different activities can be done in this mindful manner where you're focused on the current moment. You're focused on what you're doing in that moment and what's going on in the environment around you, and not focusing about the past, not focusing about the future, but just fully engulfed in what's going on in that current moment. So those are just some strategies that are out there just to give you a start or kind of a review. Of course, if you wanted to dig into these more, use Google, look up some apps, look up some websites, and dig into them, because I think a lot of these resources can be really beneficial for managing pain, managing discomfort, and other symptoms effectively after knee replacement surgery. It might not eliminate your pain and symptoms completely, but it might help decrease them, at least to the extent where maybe you don't have to take as much pain medicine, or you can tolerate activity a little bit more, or you can just tolerate your day-to-day a little bit more. And I think that's a worthwhile goal and a worthwhile thing to shoot for. Thank you very much for watching. Please leave your questions and comments below, and I'll try to get back to you. Leave a like if you found this helpful. I appreciate it. Help share this video with others who may benefit. And please subscribe if you are interested in catching any of our videos related to knee replacement surgery, post-op recovery, exercises, pain management, walking, frequently asked questions, everything else in between. Thank you very much for watching.